Sasha, sit up. It's on.
Sorry. Which one you got?
Good morning. Hello, my name is Natasha Gatewood. Okay, I'm going to start off today with a little question. So how many of you, you go out with your friends and you party, you do a little drinking, having fun. You see someone of the opposite sex and you say to yourself, looks kind of good, So you wake up the next morning, you turn over and look and say, oh my God, what have I done? If you didn't protect yourself, you could have caught genital herpes. What is genital herpes? Genital herpes is a sexually transmitted disease that is caused by herpes simplex virus 1 or 2. Herpes simplex virus 1 is normally the oral type of herpes, and virus 2 is normally the genital type of herpes. It is common mostly in women than in men. It is like 1 out of every 4 women compared to 1 out of every 5 men. How do you get it? You can get it through kissing, oral sex, vaginal sex, skin contact. The person does not have to have an outbreak in order for you to catch it. Most people don't even know they have herpes. Sores are commonly in the genital area, but not often. The symptoms, you don't have symptoms at first, but you can catch them within, they will show up about 2 weeks after you've contacted the disease. And then, it will heal in about 2 to 4 weeks. Complications of painful genital sores. You can have fever blisters, cold sores around the mouth. Having herpes causes you to catch HIV easier. And during pregnancy, it can be contracted to the baby. Most times, cesareans are given instead of vaginal delivery. There is no cure for herpes. If it is severe, your doctor will prescribe Valtrex, or you can get over-the-counter medication in order to ease your pain. Mostly, you just abstain from having sex without protection. You should ask your partner about their sexual history, or you can ask them to get tested. If you need more information, you could contact the CDC hotline for herpes or the National Herpes Hotline. If we would look to the side here, we see a few examples of herpes. This could be the herpes around the eye area, an infection. This is another picture of an early cold sore. This is the herpes on the male genitalia. This also, herpes can affect an infant scrotum, like during vaginal delivery. Herpes virus also found in pregnant women, as you can see, as in the vagina area. This is the typical female genital herpes blister. The classic presentation of genital herpes in men is around the scrotum area and all these little pieces. This is genital herpes in women. You can also get anal herpes. The herpes is a very common disease in America today. It has risen 30% since the 1970s. 1 out of every 5 Americans have herpes, young adults and adolescents. Herpes is very common these days in America. Do we have any questions? So remember, next time you go out, you should not have sex without being intoxicated. Think about that, So the next time you go out, you might want to think twice before you hook up with that good-looking girl or good-looking guy. Because, just because a person looks good doesn't mean that they're good on the inside. Okay, any questions? Yes.
I have a question.
Yes,
you said the cold sore, the form, is that just a form of herpes, or do you have herpes because I know many people have cold sores on their mouth.
Cold sores is not exactly a form of herpes, but it is a sign. There are different types, but sometimes a cold sore can mean there is herpes, so you might want to get that checked out with yourself. Okay. As you can see here, sometimes cold sores can get misunderstood to be herpes, but it's not always herpes. Okay. Any more questions from the audience?
A question?
Yes.
Okay, on the cold sore on your lip, okay, if you presume it and you treat it with lip tap or anything, and it goes away within a day or so, does that mean that might be a form of a herpes?
No, Not necessarily. Cold sores aren't always an indication of herpes. If it's like a sore opens and then scalp heals and heals over, then sometimes that could be herpes. So you might want to contact your doctor about that if it's a recurrent problem all the time.
Thank you.
Okay. Any more questions?
Yes, if you are pregnant, would it would it affect your child and cause your child's death, or?
It could cause blindness in the child. It could cause death. Miscarriages have been known to occur from the mother contracting herpes while pregnant or already being pregnant. If a mother gets pregnant after she has contracted herpes, the first outbreak is pretty severe, so it probably would cause miscarriage for the mother. Any more questions?
This stuff ain't curable, is it?
There is no cure for herpes. There is no cure. So always wrap it up. I mean, you can still have sex while you have herpes, but you should always let your partner know about your condition, and you should always wrap it up. And a condom does not 100% prove or say that you will not get it, because you can contract it from skin-to-skin contact in areas where the condom does not. Condom is not.
Did you say where herpes started? How did you contact?
Through sexual contact, you can get it orally.
Somebody that unclean sex?
Unprotected sex. If the person has a lot of sex partners, they are more susceptible to getting herpes. Any more questions? All right. That concludes our presentation for today, and I thank you all. Wrap it up. Wrap it up, y'all. Keep it right.
That was a good job. Good job.
You win 6 minutes and 50 seconds.